Hey, I'm Jeanette, the nurse educator for Parkside OB-GYN. Let's talk about the Tdap booster, who should be getting it, when they should get it, and why they should get it. ACOG recommends that pregnant patients should receive the Tdap booster in the third trimester of each pregnancy. Even if you received one during your previous pregnancy, you should still get one this pregnancy. Let's learn a little bit more about this. We'll start with the bare basics. What is Tdap anyway? Tdap stands for tetanus, diphtheria, and acellular pertussis. Acellular pertussis is the primary target of recommending this vaccine during pregnancy. Pertussis is commonly known as whooping cough because patients typically have this characteristic whoop sound to their cough when they have this illness. So it's a highly contagious respiratory illness that can affect people of all ages. But for babies less than a year old, it can cause very serious illness and even death. And actually, babies less than 3 months of age have the highest risk of developing severe disease and of actually dying from pertussis. They don't get their first dose of Tdap, which is the childhood vaccine, until they're 2 months old. So the ACOG recommendation for you to get this during third trimester of pregnancy is specifically to protect your vulnerable baby from whooping cough. You really should receive the booster between 27 and 36 weeks of pregnancy. Here at Parkside OB, we usually offer this around 30 weeks. And this timing allows your body ample time to create protection, even if you were to deliver before 37 weeks. It takes about 2 weeks to create ample protection. So during this time, your body will create an abundance of antibodies against the pertussis bacteria. Those antibodies then travel through your bloodstream, crossing the placenta, and pass along to your unborn baby. Then when you deliver your baby, he or she will be born with some protection against whooping cough, greatly reducing the risk of developing severe disease or dying from the illness. And when you breastfeed, they also get additional protection from your breast milk. Other adults should also get a booster if it's been over 5 years since they last received a Tdap, or if they don't remember when they last got one. This includes fathers, partners, aunts and uncles, grandparents, nannies, etc. And this is recommended at least 2 weeks before they come into contact with your newborn baby. To make things easier, we can give your care partner Tdap here in the office when you get yours. Kids and teenagers who receive regular immunization should be fine. Our last scheduled dose of Tdap is right before 7th grade. I want you to keep in mind that not all tetanus shots contain protection against pertussis. If you have a friend or family member that had a tetanus shot recently, they should check their records to be sure it was Tdap and not just TD, which only protects against tetanus and diphtheria. A lot of patients ask, will they be forced to take it? We really support informed decision making. I hope that we've provided the information you need to make your decision. If you have more specific questions, ask your provider at your next visit. It's your choice whether you decide to get the Tdap booster or not. If you decide not to get it, please take measures to protect yourself and your baby. Wash your hands often, avoid touching your face, don't eat or drink after others, and don't allow others to kiss on your baby. Thank you so much for taking time to learn more about why we recommend getting the Tdap vaccine in the third trimester of each pregnancy. Remember, this is general education intended to help Parkside OB-GYN patients make informed decisions. It isn't intended to replace the advice and guidance of your healthcare providers.